Welcome to the Whole Health Podcast,
where a functional nutritionist and a biological dentist investigate the interconnectedness of your health.
Let's get started. Welcome back to the Whole Health Podcast. Today is a special episode, I feel like, because this is an exciting moment for you. You've just released your first book, Feel Whole Again, your humanistic guide to healthcare. And today I'm going to interview you like a guest.
Oh, boy.
And dig into this because this is a huge undertaking, first of all, but most people don't write books unless they feel like something needs to be said that hasn't been said. So can we start there?
Absolutely. I was thinking about it this morning, kind of in mental preparation for us having this conversation. And I think you've been privy to my past story that at 21 years of age, I felt called by God to become a dentist right as I was completing my bachelor's degree in psychology. Yeah. And so for a long time, I had this curiosity about, what purpose would this appreciation of psychological understanding about people's feelings, their thoughts, their emotions, how would that tie into the profession that I'm in, which is dentistry, specifically biological approach to dentistry. And maybe about 10 years ago, it dawned on me that the way that we engage with people in my practice is about people first. It's about understanding the value of what's going on inside their heart, what's going on inside their spirit. Because so much of healthcare, especially today, it's so objectively focused. Right. Like, what are your blood results? Mm-hmm. Let's read the metrics. Let's find a pill to prescribe you. And but that just basically ignores all of the subjective aspects of healthcare, your thoughts, feelings, emotions, and how those play into health. So this book had been in my brain for about 10 years, and I tried a couple of different times writing it on my own with the help of a couple of guides, you might call them. And then about a year and a half ago, a guy pings me, sends me an email. He says, "Hey, I'm a professor at Georgetown. I just listened to your podcast with the Wellness Mama, and I have a side business helping people write books." And he said, "Man, what you shared, this is a book." And I'm like, wow, this is kind of an answer to a prayer. And the beauty was his company, had a step-by-step system for how to write it, accountability partners, coaches. And so it gave me the opportunity with a lot of great help to write down my thoughts about feeling whole again and the value of humanistic connection in a healthcare setting.
Yeah, it's interesting that you brought up the objective and subjective. And I think for our listeners, if you're not in healthcare, you may not know that when providers interact with patients, often it's documented in something called a SOAP note, which stands for subjective, objective, assessment, and then plan. And when you go to a medical provider, oftentimes you do live in that objective world, right? It is your labs, it's your symptoms, it's your previous diagnosis, it's your family history, but very little time and energy is spent in that subjective zone, which is what's your experience of your body? How do you feel? What do you think is going on? What do I need to know about your story? Which is probably why you have a pretty long new patient experience. So you can gather that and so you can connect with the patient. So it makes sense to me. You do things very differently in your practice so you can be a human with another human and understand their story. I'm interested in how you formatted this book because your chapters follow a pattern of
I'm glad you picked up on that.
And I want to talk about that because I when I first cracked your book and I was excited to read this, and I had seen edits throughout the way and you'd sent me things, but I hadn't seen the titles of your chapters. And when I opened that, I thought, wow, this is really interesting. Can I read a few of them?
Oh, please do.
Okay. So chapter 1 is Imbalanced Power Dynamics in Healthcare. Chapter 2, who is in charge of your health? And then we're getting into, the first half of the book, and it's feeling confused when medical dogma and your experiences are at odds. It's kind of the patient experience of, this is not what I'm looking for. This does not feel good, right? And then the second half of these chapters are things like feeling connected, developing a synergistic link with a healthcare provider on your wavelength, feeling informed, the power of becoming your own health advocate. So I'm interested, what led you to format your book that way? Why was that important to you?
Yeah. Well, first I wanted to acknowledge that there is a power imbalance, generally speaking, in healthcare. Even when I was in dental school, the idea that, some people have a mindset of, well, you're the doctor. I write about that in the book, which says to me, you're relinquishing your agency over your own health and you would like for another person to take over to make that choice for you. That then places the burden of that decision and the responsibility on the healthcare provider. And because I'm somewhat emotionally and psychologically aware, I don't want to carry that burden.
Right.
I want to be a guide. I want to be helpful, but I want to do that with people who prefer to be responsible for their own healthcare experience. So in terms of how I formatted the chapters, it helps to appreciate, I'm highly visual. I see things, and one of the diagrams that I saw going back 7 years when I was doing my integrative medical dental training, reading the book Power versus Force, and looking at emotional states and their energetic resonance levels. And things like fear, anger, hopelessness have very low, negative energy levels that literally take energy away from a person. So what I wanted to diagram or display is that when you're feeling frustrated, when you're feeling angry, worst of all, if you feel ashamed or you feel guilty about whatever, your past life experiences or shame about things that happened to you or whatever that is, it is next to impossible to move into a state of health and wellness when you reside in a place that daily takes your energy away. So the apex of these chapters is, or I should say it's almost an inverted apex, as we're kind of going down the slope of energetic resonance, is a state of hopelessness. So when I'm talking with somebody and they're sharing their story and I hear a word like, I feel ashamed or I feel guilty or I feel hopeless, I realize that until we shift the perspective of what is possible, and it, of course, greatly helps when we share with them that your feelings, both physically and emotionally, actually matter.
Right.
And we want to understand them. We want to hear your backstory so that we can best not only help you fix teeth, that's mechanical and very easy, but we can help you change your mindset about that health is possible, in all aspects of your existence. So after hopeless, and I share a story about a woman who came to us years ago. She had jawbone cavitations and had been sick for about 45 years. Sick since her wisdom, the day after her wisdom teeth came out. And as we started to share with her what we were observing in her cone beam scans, when we started sharing with her that how she described what she was feeling all had meaning and helped us understand the pathway. Of course, she was put on drugs for years.
Right.
It was all helpful in our understanding of what was going on. Then we start to go from feeling hopeless to feeling hope. And that shift, you can literally feel it in the room when they, their energy elevates, they get a smile on their face. Oftentimes there are tears. And then I build on that to see this is how then you escalate your energetic resonance in relationship with a healthcare provider.
Yeah.
Which that takes a lot of thoughtfulness, particularly considering, one, the types of human beings that are generally admitted to healthcare programs. And I talk about that in the book. And when we objectively look at what are the requirements for human beings to accomplish in a college setting in order to get into med school, nursing school, dental school, whatever, it is highly scientific, which is great. I mean, that's absolutely fantastic. But there is almost zero requirement for any humanistic types of studies, psychology, sociology, communication skills.
Right.
Which is kind of odd because in healthcare, you're actually serving a human being. You're not serving a kidney. You're not serving a large intestine. You're not serving a wisdom tooth. You're serving the human being who's the host of those anatomical parts. So that's really what, is such a differentiator. My practice is an expression of all my thoughts and beliefs that I've written down in this book. And I think if people read it, they'll understand, like, this has been a growth process for us as well. I mean, it took me 20 years of practice to divorce myself from the traditional model of how people even walk in a door and sit down and are immediately led to a dental chair.
Right.
Like, we've changed everything about the experience because we want emotionally, first and foremost, for people to feel connected. And, our team is highly trained in communication skills because that's our goal, is we want to connect with human beings.
I love that. I was mentioning to you earlier that I was laying in bed the other night and I was reading through the book again and making some notes, and my husband walked in and said, "Oh, is that Kelly's new book?" I said, "Yeah." He said, "Well, it doesn't look like a dental book." And I said, "Well, it's not really a dental book. I mean, there's a lot of stories about dentistry. You're a dentist, so you see this through your lens.
Yeah.
But it's really a book about, it's more than even healthcare. It's really a book about how we honor each other and our own experiences in life, right? Yeah. And not try to take those away from people."
Absolutely.
So I had highlighted something that was a flashback for me back to psychology in my undergrad program, and it was such a lovely reminder. I was like empowered just reading this, the locus of control. And I think about this a lot in what I do, because similarly in working with people that feel like they don't know where to turn for answers, they kind of end up maybe even not even intentionally giving away their control. But I would love for you to speak to this. And do you mind if I read just a couple sentences to
please do.
Kind of prime you?
Yeah.
If you're not familiar with this concept, it refers to how much control a person believes they have over the events and experiences in their life. People with an internal locus of control believe that things happen to them are greatly influenced by their own abilities, actions, choices, and mistakes. So there's a lot of ownership there.
Yes.
Those with an external locus of control tend to feel that other forces, such as random chance, environmental factors, or actions of others, are responsible for the events that occur in their life. It is a spectrum concept, and people can land anywhere they choose based on their individual personality, psychology, life experience, and social cues from their family of origin. And I just think this is really fascinating in the range of people you probably see. So can you tell us a little bit about how this concept affects what you see in your patient population and their healing journey? Boy,
yeah, that's absolutely. And it's a vast range, like from one end of the spectrum, again, looking through the lens of a dental experience, let's say, the person who comes in and says, "Oh, I just genetically have bad teeth." So it's this, I'm not responsible, my pack-a-day smoking habit has no impact. The fear that I have felt my entire life because of the abusive nature of my dental relationship as a child. It's just like, it ignores all of these things that also matter. And the reality in my experience at least, for the majority of people is their body is designed to heal and be well, period. That's the way we are designed. But as you read in my very first sentence in the book, too many people feel like shit.
Yeah.
So something's missing here. Could it be, that the agricultural, approach in our country is, screwed up and all that? Yeah, sure. There's a lot of things we can point to, and chronic toxicity and all this and that. But something that is formed over the last, I would say, 100 years is the relinquishing of control of your own health. And what I believe, and I believe this is truth, is that even your thoughts matter and shape your health. So how we talk to ourselves about, like, for instance, well, I've been diagnosed with, or I am, fill in the blank, I am diabetic.
Right.
Yeah. I am depressed. You're now labeling yourself with something that is not true. You're experiencing symptoms, to be sure. For the people I see, you're experiencing symptoms of gum inflammation. You're experiencing symptoms of grinding your teeth. That doesn't mean to say, I am a bruxer.
Yeah.
But if we label it, then we can blame the patient, and it's not true. So that's why I took the time to, point out that, in my opinion, health starts with our belief system. And when we believe we are meant to be well, then all these things that we experience that are normal parts of human experience, like anxiety, sure, we all have these feelings of, I think back to like when I was 8 years old and, at the piano recital, and like you can't hardly get out of the bathroom because you're so nervous. Today we'd probably call that anxiety. My mom would say, well, that's nervousness, that's normal. And
absolutely,
after you do it, you'll feel better.
Yes.
And then you grow. And that's health. Yeah. So, I thought it was an important thing to bring out as a foundational element as I'm writing this book, that the responsibility is yours to decide that you will be well or you can't. That's a decision. That's not a physiologic issue. That's a mental and spiritual issue. So that's really the foundation of the book. Ownership.
Yeah, I love that. And I feel like some people, I imagine, come in to see you and they have been brainwashed by our system to believe that they don't have control, because in medicine, we generally teach people that they don't have control, right? It's like I always say they get hit on the head with the bad luck stick, right? Like, whoopsie, too bad, you got diabetes. Uh-oh, you have heart disease. Yeah, exactly.
Because it sells us more drugs.
Yes, exactly. So what's your process like for shifting that belief system?
Well, that's a good question. So I wouldn't say that I necessarily have a process. I have coached my team to be incessantly curious. And by asking questions, what we're doing is taking the temperature of their own belief system. So the questions can come in so many forms. It could sound like, let's say somebody's really struggling and they're feeling down. I might ask them, based on what we're talking about helping you accomplish, which is likely going to start with nutritional management, which is when I refer them to you. It's also going to look like whatever chronic energetic disturbances, root canals, titanium implants, metal fillings, cavitations, things like that we might help them with. What would it look like? Do you have a vision of what your life is going to look like after you've managed this? Those people who can tell me, oh man, yeah, I'm really looking forward to X, Y, and Z. I want to go back on hikes with my husband. I haven't been able to walk without oxygen support in 3 years. Mm-hmm. Those people who already have the vision are usually going to accomplish it. When people tell me like, man, I don't even know, I can't envision a life where I don't feel like this. Well, then we're going to halt, engaging in any sort of care that my hands would provide until they believe that it's possible that they will feel well. So that's different, than your average dental experience. Typically it's, there's a chapter where I describe like the common experience for a lot of people. You're sitting in a chair, you're leaning back, the dentist walks in because he's got 30 seconds between patients. And the dentist sits down and, poke, looks at the x-rays, maybe the hygienist says something, and they're like, all right, well, they need 3 fillings and schedule them, I need an hour. And it's 100% transactional. It has nothing to do with how this person's feeling. It's like, but that's people's experiences moreover. So the way that we engage helping people at Blodgett Dental Care is we want to be a support system for their health journey to help make it better. And it starts with them believing that that's possible. And if they don't believe it's possible, we're not going to engage. And we're going to maybe, as I have for some patients, made suggestions about, are you open to the idea of talking to a great counselor about your past trauma? Because it's real and it's significant, and that negative, perpetual resonant energy in your life, it's preventing you from feeling better, but you can deal with it and you can process it, and you can, to the point of the book, you can feel whole again. So it's kind of our twist, which takes a ton of time.
Yeah.
Every new patient who comes to our practice, they're going to be there for at least 2 hours, sometimes 2.5 hours, because it takes that much time to get to know somebody. I can't get to know somebody just looking at their x-rays.
Yeah, certainly. You got to sit down and have a cup of coffee with them to really get the backstory, right?
Yeah.
So that story that you told, the little bit of that story in the book where the dentist sits down and tells the patient what they're going to do, that reminded me of another passage I had highlighted. I don't even need to open the book because we've talked about this before, but it comes up in my mind a lot when we talk about words we use with patients. Mm-hmm. So you have 2 words in your clinic that you do not use and you have trained your team not to use. So I would love for you to share those words and the why behind them.
Absolutely. Okay. Oh, you're hitting on one of my all-time favorite topics, which always, every time I bring this up when I'm giving a lecture somewhere, because it's really important to me. I know that there's tons of people who know a lot more about a lot of things than I do, but this is really where my heart is language. Okay. And the intentionality around language. So, the first word in my practice, when I bring a new team member on, I ask them if they would be comfortable not ever using the words need and should when they're in the 4 walls of our building. And they look at me, always look at me weird. And I'm like, well, think about when you tell somebody, here's a classic example. Somebody comes in, especially in the biological dental world these days, I want my mercury fillings out, let's say. So they go get their mercury fillings out. Hopefully it's safely. And, a tooth hurts afterward. So they come back, they test the tooth. It's sensitive. The patient shares, yeah, ever since it's been done, it's sore. Oh, looks like you need a root canal. And that's it.
Right.
God has spoken, so to speak. So if you think about the dynamics of that language, they're saying that you need to do this. Now, in reality, there are a lot of different options that patient could consider, but they're only being given one. And unfortunately, just as a side note, within today's medical legal standard, that's acceptable because providers are only required to offer options that they, based on their training and experience, that they believe to be appropriate, which is why it's so important that people take ownership of their own health care, because they're going to get these dogmatic, you need or you should, do X, Y, and Z. So what happens when I ask team members to no longer use those words when they're in the Blodgett Dental Care building is it causes them to think about the words that they're going to use. If I can't say need because I was trained to say need in hygiene school, how else would I say this? Well, maybe you'd say, first of all, I'm sorry your tooth hurts. It's possible, I know you've shared with me your goal is you'd like to keep healthy teeth the rest of your life. And let's say the tooth is sensitive, but it's not blowing up on them. And like, well, maybe there was something to do with the filling. It's possible that the filling, because it shrinks, when you cure it, maybe it's putting some tension on the tooth and it would be helpful to remove it try doing it again, try a different approach. That's one option. A root canal is a second option. It certainly, take away your ability to feel anything with that tooth. However, now you're left with a dead tooth in your living jawbone, which has health consequences. You could also just take out the tooth and do nothing. You could take out the tooth and do an implant. There are different options. In our practice, because we start with, please share with me, what are the goals for your health? Draw me the picture of what you'd like your oral health to look like between now and the rest of your life. Therefore, everything we talk about relates to helping them accomplish those goals. It's no longer about, well, we just do this one thing, so therefore we tell you need it. So that being said, to anybody listening to this podcast, it is highly likely that they will be talking to their nutritional therapist, their naturopath, their acupuncturist, their physician, their dentist, and they're going to hear, what you need to do here is you need to get on this. You need to do that and you need to do this. And the reality is, you don't need to do any of that. Why are we saying that? It's not a need. We need oxygen, otherwise we die. We need water, not to the extent that we need oxygen, but those are needs.
Yep.
Shelter helps. But you don't need a root canal. And so I kind of bang that home in the book. I really get into it when I'm coaching other practices. And again, it's not so much about the word because of the word in and of itself. It's because of the autonomy that it steals from the patient.
Yeah. And I'm glad that you touched on goals, because that was another thing I wanted to ask you about. If you don't know where you're going or why you're going, it's really hard to stay motivated to get there. And I think it's interesting how many patients walk in and haven't thought about their goal. It's the first question in our patient intake paperwork, right? Because it's hard to stay motivated if you don't know why you're doing something.
Yeah.
So to that end, I'm interested, who do you feel like this book is for?
The book was written primarily for, I don't want to say patients, it's for people. It's for people who want to acknowledge the strength and power that they have over their own healthcare experience. Hence the subtitle, Your Humanistic Guide to Healthcare. There's a chapter at the end of the book that is kind of a shout out to healthcare providers. And my attempt is to appeal to people to become conscientious of the fact that their words and their energy and of their teams, because oftentimes, people interact with teams at healthcare practice more than they do the physician, that it really matters. And the more that we as providers uplift people into their own power, the healthier they can become. But it's really for people who want to take ownership of their own health.
I think, you and I have spoken before personally and on this podcast about how I had no dental trauma and I had no preconceived notions about dentists. So when you and I started working together and you were telling me about people that, it was very hard for them to even seek dental care and there was all the shame and guilt wrapped up, I had to think through experiences that were not my own experiences. Yeah. And now we've worked on so many cases together through the lens of the patient's goals and understanding how their oral health is affecting their systemic health. And one of the things I've learned along the way is that people that have dental health issues, especially when they're visible,
yeah.
It's much like people that are experiencing alopecia, or they have a skin issue that's visible, or a weight issue, or something else where they feel like they hang their health issue on their sleeve all the time and everyone can see it. Yeah. There is a lot of emotion wrapped up in those conditions. And because of that, and not just from the dental lens, I feel that this book had to be written to help people understand how to navigate through the shame, how to bring the humanity back to this. And I don't think a book like this exists. There's a lot of books on healthcare. There's a lot of books on medicine. There's, we are overwhelmed right now by data about health, but that's not what this is. this is a guide to helping people navigate through their emotional experience of healthcare, to be empowered and to seek the care that they actually deserve. And I really applaud you for this.
Thank you.
Yeah.
I truly appreciate that. Man, it was an incredible amount of work. And I'll share a story that, it was just, by the time this actually is produced, it'll be months after this conversation, but, it came out in the end of August, and, we were able to get some copies soon thereafter and started putting them on the shelf at the office. And the other day I had helped a woman. She was the first patient of the morning, and then she was hanging out in our reception area, enjoying a coffee or something after her care, waiting for her husband to pick her up. And she asked, "Hey, can I, take a look at this book?" And, of course, take a copy and then it's yours. And so she sat down and started reading it. And 10 or 15 minutes later, I heard about this from my front office team later, that she just starts sobbing.
Oh.
And you should probably into the, deep into the first or into the second chapter. It was so resonating with the past struggles she had experienced that it was bringing her to tears right in the middle of our front office space. And, for me to hear that kind of story, that I believe that it is going to have a major impact in healthcare. I'm this, one dentist in Portland, Oregon, doing my part to make the world better. And, my prayer is that somehow, some way, I have the opportunity to start sharing this on a world stage where we remind people of their own personal power, and that everything they've experienced is, it is what it is. And, I acknowledge a lot of what I would call thought leaders, current thought leaders, Dr. Bruce Lipton, Biology of Belief, Peter Crone, some great thinkers out there who help us take ownership of our own feelings. And dentistry it's the redheaded stepchild, pardon the phrase, but it's the one place nobody wants to go. I hear maybe the gynecologist might be up there as well, but incredibly, as opposed to your life experience in dentistry, and mine was like yours. I had a wonderful dental team growing up. I never had dental issues, thankfully. I always perceived it in a positive light. But of course, when I started in dental school and started hearing people's stories, even my father's stories of going to see the dentist as a little kid, slow speed, abusive drills, no numbness, just torture, literally torture. And not only physically, but the emotional toll that can take on people when they are taken out of control, put in painful situations. That's scarring, but it's also possible to move beyond it. So that's what the book's here to do.
Well, like I said, I applaud you. Congratulations. I can see it was a huge undertaking, but it really is. It's a really beautiful expression of you, your practice, your understanding in this specialty, but in healthcare at large, and just your unique background as a person that understands not just psychology, but really the human experience. So it is my hope that people pick this up. Everybody picks this up because everybody is a patient at one point in time. Every provider is a patient at one point in time. And so it's an education for a provider, it's an education for a patient and a human.
Yeah.
So,
and that's, the point of being humanistic, we're all humans helping. That's our practice tagline is human beings helping human beings. We're no more special than anybody else. So why do we think that, it's all about what we have to tell you and what you need and should do,
Yeah, absolutely.
So, well, thank you for the opportunity to talk about it, Megan. I appreciate it.
Thanks for bringing this into the world. It's really special.
I hope that people get 10 copies, send them out, give them to friends and family, share it at Christmas.
I'm already thinking of all the people that really need to read this, not only in my personal life, but in my professional life. Hold please.
Yes.
I'd like to make a note that I just said need, and I would like to
rewind.
I bet you did. I bet it was like a zinger, what did she just say? So I am thinking of all the people that would benefit and enjoy a learning experience like this book.
I love it. Thank you, Megan. Appreciate it.
Thanks for being here to discuss your very special book, Feel Whole Again, The Humanistic Guide
Go out and get a copy.
to Healthcare.
Absolutely.
Thanks so much for tuning in to the Whole Health Podcast.
If you enjoyed what you heard today, please follow us on social media and wherever you listen to podcasts.
You can find out more about us at thewholehealthpodcast.com.
You can find me on my website, blodgettdentalcare.com.
And you can find me at bioloungepdx.com or learn more about my organic soluble fiber supplement, Fluorosophy, at thinkfluorosophy.com.
We look forward to seeing you next time.